From bike accidents and bee stings to more serious medical emergencies, how do you know where to go? Do you go to urgent care or do you go to the ER? And what is the difference? With us today to talk about this is Dr. Anthony Callisto. He is the medical director for the St. Mary's Sun Prairie Emergency Center, which just opened up. So congratulations.
Thank you.
Tell us what this center is about.
Well, it's a freestanding emergency center that has about 13 beds. We're very excited to bring that to the community of Sun Prairie today. So we've been doing very well. We just opened just in time for the Greyhound bus crash. So.
Wow, so that was your first incident.
It was.
Your first big incident.
About a block from our place.
Unbelievable that you were there as a resource. Okay, so we're talking ER versus urgent care, and this is an emergency medical center. So we're going to talk about the 5 points in terms of people choosing to go to an ER.
Okay.
All right, so we're going to start with, that's where your primary physician tells you to go.
Exactly. If you're concerned about any of your medical well-being, you can always call your primary care physician. It's an excellent resource for that. But if you do feel you're having a medical emergency, we always emphasize that you call 911.
So that's a great place to start right there.
Yes.
If you suspect that you're having a heart attack or a stroke, is the second point you want to make.
Yes, exactly. These are very important to get in front of a physician as soon as possible, especially an emergency physician, because the time to the cath lab for a heart attack or perhaps some advanced radiologic procedures for a stroke actually cuts down on incidence of death and mortalities.
Okay, third point, severe abdominal pain. Go to the ER, especially if you're pregnant.
Exactly. Life-threatening emergencies can occur with abdominal pain. In pregnancy, there can be pregnancies in the wrong place in the tubes that can rupture. Very, very life-threatening.
What might it be, severe abdominal pain? What do you often see when people do have an emergency?
Any surgical abnormality. You can have a gallbladder that needs coming out, appendicitis, anything like that needs to go to the operating room, not to an urgent care.
Versus just a really bad hot dog or something.
Exactly.
Okay. Fourth point, possible bone fractures.
Right.
Head to the ER.
Yeah, exactly. Especially long bone fractures. Fingers and toes we don't do much for, but you may need surgery for some fractures, and we need to make sure that all of your nerves and blood vessels are intact.
Okay, fifth point, moderate or severe burns. Obviously, you want to get to the emergency room immediately.
Exactly. Minor burns that are just kind of look like sunburns, but blistering is immediately to the ER.
Biggest point that you want to make about sending someone to urgent care?
Urgent care is for your basic things that you're comfortable talking to your regular physician about instead of waiting for the next day.
Okay, so a cold or sinus problem or whatever it might be.
Exactly.
Something that's just not an acute emergency.
Yes.
Got it.
Perfect.
All right, Dr. Callisto, thank you very much. Congratulations again on the new center opening. We appreciate the insights.